basically the weight loss drug market in India. Novo Nordisk is set to launch Ozempic, which is basically the weight loss and diabetes drug in India today. This is after launching Wegovy, which is specifically for weight loss earlier this year. The company, in fact, is looking to launch this semaglutide molecule for diabetes in 3 strengths and at similar price points to Wegovy. In fact, I did catch up with the managing director of Novo Nordisk, Shrotriya, to discuss the company's India opportunity. We also quizzed him on the legal issues with Dr. Reddy's and Sun Pharma right now. So listen in to that conversation.
The higher strength of semaglutide, which actually we have launched till 2.4 milligram, is for obesity. And we are launching this brand for the benefit of type 2 diabetes. And that itself is a big and a huge burden in India, given that we have got more than 100 million population which is getting affected by diabetes, and almost 77 out of 100, they do not have a control. So we are launching this semaglutide in 3 strength, 0.25, 0.5 and 1 milligram for the benefit of type 2 diabetes patient. So it is very clear that the 3 strength which we are launching is for diabetes, and till 2.4 milligram which we have launched is for obesity.
Okay. All right. I wanted to understand that you already have Rybelsus in the market, but the latest data showed that maybe there is a little bit of slowing of sales of Rybelsus. Is that one of the reasons why you're also launching Ozempic, that maybe the oral weight loss drug or oral diabetes drug, semaglutide, is not showing as much traction as anticipated?
I would say that's not exactly the reason. It's a flexible portfolio approach. You know, some of the people would like to write with a ball pen, and still people would like to use the ink pen, and somebody would like to write with a pencil. So semaglutide, which is available now in oral formulation, we have seen the increased appetite of people to accept injectable, which we never saw earlier with insulin. So that is the reason we are actually launching this injectable semaglutide. But on the other side, the oral semaglutide is still on the growth trajectory. But we have to remember that it is now 4th year of the launch, and in the 4th year of the launch, the distribution channel, the pickup of the brand, it changes over a period of time. But we are still very bullish on the oral formulation, because normally if you see diabetes patient in India, 75% of them still prefer oral treatment over injectable. So I think so there is a play both for oral semaglutide and also for injectable semaglutide.
Okay. All right. Well, Vikrant, you know, Wegovy, you launched it a couple of months ago in the month of June. It's taken a significant price cut recently by around 30 to 35% to drive up demand. Are you looking to do the same for Ozempic, come in at possibly lower price points, or maybe look at lower price points in the future? What exactly is the pricing for Ozempic in the market currently?
See, the first thing I and my team we look forward to is to get the innovation in India. And then after the innovation, we look for the accessibility of the molecule in India. Now, we got the response, we got the feedback that the right price should be what we have taken actually now for the injectable semaglutide for obesity. This was a bold step in terms of 37% price reduction. Was a huge step. But we have seen the kind of acceptability of the molecule which is actually there. Now for Ozempic, we would like to be in the same range bound, because we know that more and more patients can actually now afford this kind of a price point when it comes to injectable semaglutide. So we will be range bound with this price point.
All right, Vikrant, you know, I just wanted to touch upon Novo Nordisk having moved the Delhi High Court in order to restrain Sun Pharma from launching the generic form of semaglutide. What is the crux of the legal matter, and where do things stand?
I mean, I would say the legal course of action is under the, you can say, review, and our lawyers are actually fighting, reviewing and seeing that we deserve the patent right till the time it has to be there in the country. So I think so it is under sub-justice, and I think so let it be there. I'm actually not, I'm not able to comment on that.
Okay, all right. But for Dr. Reddy's, you all have been allowed, or they have been allowed to export semaglutide to non-patent countries. What is the key contention point that Novo Nordisk has in that case? And is Novo Nordisk going to appeal?
Our lawyers are reviewing it, and we are waiting for their, you can say, what they would like to take an action, and I think so. We wait for that.
Okay, fair enough. Vikrant, you all have also partnered with Emcure for a second brand name of Wegovy, which is Poviztra. And when exactly is that launching in the Indian market? Is that something that you all are looking to probably do with Ozempic as well?
I would say that for any of the medication, any of the molecules, our try is as fast as possible. Because the earlier the launch is, the better the access would be. And it is our try that we launch along with Emcure much more faster. And of course, the goods have to come, the production has to happen. So we have just signed the deal, but soon you will see that we will have the products in India.
All right. Just give us a sense, because Vikrant, the big event which is going to take place is that semaglutide is going to go off patent in the month of March in India. When that happens, what is your sense in terms of what the competition will be like? And it is expected to be a competitive market. And how exactly is Novo Nordisk then going to compete in that?
I would say that competition is one part of it, but we are driven by commitment. Because when more number of players come, there is going to be a little more awareness about the medication, about the disease. And I think so that is a very good positive aspect. Similarly, in this market also, post the LOE period, when more number of players come, I think so we welcome them. But we would like to welcome them with a very long commitment, very long purpose.
"26 years of CNBC TV18.